Is the next speaker, Kanchita?
Good evening all. Today's my presentation is on hemangioma or CNVM. So what is choroidal hemangioma? Is a benign vascular tumor of the choroid of the blood vessel layer beneath the retina. It can be of circumscribed, which is solitary, or diffuse, that is associated with Struck-Weber syndrome. Here is a case presentation. We presented a case of 37-year-old female presented with defective vision in left eye for past 3 months. Best corrected visual acuity of right eye is 6/6, whereas left eye is 6/24. History of left eye anti-VEGF injections given 2 times at private hospital 2 months back. On fundus examination of right eye was normal and left eye revealed an orange-red elevated lesion involving the macula with subretinal fluid. Of other salient features of the FFA showed left eye hyperfluorescence in the foveal region with lazy network of vessels in early phase with increased hyperfluorescence with variable leakage. Left eye OCT shows subfoveal hyperreflectivity with irregular RP lesion and subretinal fluid. Here is the OCT image showing the subretinal fluid and the fundus image showing the orange-red elevated mass. FFA shows hyperfluorescence in foveal region with lacy network of vessels with the early phase with increased hyperfluorescence in the variable leakage. So what is unique? Patient was advised further anti-VEGF injections and photodynamic therapy on further visits. What is unique in my case is choroidal hemangioma is a hematoma that may be present at birth and majority of the patients manifest symptoms and present in adulthood in 4th decade. They do not metastasize. However, it involves macula and center of vision and is causing a retinal detachment. It is treated to save vision. Always have a differential diagnosis of this type of cases, which is of amelanotic melanoma, central serous retinopathy, choroidal neovascularization, choroidal osteoma. Although choroidal hemangioma is a rare retinal finding, it is important to distinguish from similar retinal and choroidal tumors. Prompt diagnosis by retina specialist is necessary if any uncertainty exists. When macular subretinal fluid is present, various treatment options are available like argon laser photocoagulation and photodynamic therapy and anti-VEGF therapy. Choroidal hemangioma is orange red mass, symptomatic during early adulthood, can result in exudative RD, and if vision is threatening, early diagnosis and management is mandatory. Thank you.
Can you show me the FA of this patient? Fluorescein angiography?
Yes.
AV team, please make the presentation visible on the main screen also.
FA में how did you make a diagnosis of choroidal hemangioma in this patient?
Sir, in early phase it was a lazy hyperfluorescence during.
And why there is a block fluorescence? Hemangioma में तो ऐसा block.
So surrounding edema with the subretinal fluid.
No. Hemangioma is known to cause and diffuse leakage.
Yeah,
and
in
you
late
should confirm
phases,
on ultrasound also. So I don't think so. It's in case of
If
hemangioma.
you have a neurosensory detachment, there will be some degree of pooling.
And can you show me the OCT? FA, RP, would you like to comment, Ankur? Ki FA mein, is it looking like hemangioma?
So,
Can you go back to fluorescein angiography?
so you have rightly mentioned it will lit up on FFA, and then if there is a neurosensory leak, so in late phase there would be staining, so it would look like that it lights up in early phase, and the margins get blurry and it's diffuse fluorescence at the fovea because of the late staining of the fluid.
Can you go to colored photograph, please? It's not an hemangioma. It's in CNVM.
And you also treated with anti-VEGF, right?
Anti-VEGF do respond. A third thing is ki you said ki argon laser photocoagulation in macular hemangioma is not the recommended line of treatment. If you are dealing with a macular hemangioma, full dose PDT is the treatment, but it's not an hemangioma. Next, please.
Yeah, but what the B scan? Have you done the B scan in this?
B scan picture is not.
That is not done? Because that can also cleanse the diagnosis. It will show the heterogeneous ecogenic status.
Yes.